Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to give you some tips on how to navigate through your pregnancy during this coronavirus pandemic. First, let's talk about the steps you can take recommended by the CDC to prevent yourself becoming infected from COVID-19. Staying at home whenever you are sick, avoiding close contact with sick people, washing your hands at least 20 seconds with soap and water, and I have a video on that where I detail how to do this properly. Also, not touching your mouth or nose or eyes with unwashed hands. Always disinfecting and cleaning objects that have came into contact with other things frequently. If you have to sneeze or cough, cover your face. Social distancing, you want to keep at least a 6-foot distance from other people. Avoiding crowded places, and recently it was recommended that if you go out in public, you should wear a cloth mask to help protect yourself. So two big things that pregnant women are going to face in regards of having to go out will be those essential grocery shopping trips and those prenatal visits. So first, grocery shopping. With grocery shopping, try to get someone else to do it if that's possible. If not, there's a lot of options that you can do instead of having to go directly to the store. Like you can do delivery, you can do online shopping, or you can do a pickup service. So with my experience, what I do is I do either shop online where they deliver it to my house. Now, if that is the case, whenever I get the packages, have to open up the boxes, I always wash my hands because I don't know where that box has been. It's been throughout the US. Or I do the Walmart pickup service where I order online, I go and pick it up. And that's really good because I hardly come into contact with anyone. I open my trunk, they put the groceries in there, and they even sign for me. So after all that, of course, I do hand hygiene after putting all the groceries up and everything, and that decreases my risk of coming in contact with the virus. Next are prenatal visits, which again is another essential thing that a pregnant woman has to go to. And it's recommended that pregnant women keep going to their prenatal visits. Now, unfortunately, the further along you get, you really have to go to these visits in person because your provider is going to be measuring your blood pressure, and you're looking at your urine for glucose and protein. That's looking and screening for gestational diabetes and preeclampsia. Also, they are listening to baby's heart rate, measuring your fundal height, making sure everything's going well. And you really can't do that over the phone or through a video chat. So whenever you go to your OB office, you want to call them and you want to ask them, okay, what are some things you all are doing to help keep me safe? And what are some things that I need to do? Because if you live in a high-risk area, you definitely want to implement very strict steps whenever you have to go to these visits. And my experience is that whenever I go there, they always screen everyone, ask you questions before they let you in. I also wear a mask to my visits. Everyone who's working in the area, including the physicians, are wearing masks, and I keep a social distance from everyone. So all the chairs, they have them taped off so you can only sit in certain areas so you're not close to people. Also, I make sure that I wash my hands immediately afterwards. I don't touch my eyes, nose, or mouth, and I disinfect everything that came into contact with that office. And lastly, you always want to make sure that you are avoiding trying any type of herbal treatments or things that say they can cure the coronavirus or prevent the coronavirus without consulting with your OB provider, because there's a lot of things that circulate on social media and on the internet that say that it can help out. And unfortunately, there have been some stories of people who have tried some of these things and they have either experienced some really bad side effects or they have died. So always be leery of those things. Now let's talk about some things you want to consider before your baby actually gets here. So with pregnancy, there's a lot of fun things you get to do. You get to do a baby shower and you can do a gender reveal. However, during this time with the coronavirus and social distancing, those things really are not a great idea. So you have to get a little creative in what you can do. Well, first of all, if you're due a little bit later on, maybe you can postpone it. But if you're not, you could get creative and do something online, like live stream with your family and have something like that. or have them send gifts to you online or do an online registry. Next, you want to start planning for the birth of your baby now, regardless if you're delivering in a few months or you're delivering this fall, because they potentially say that this virus could make a comeback this fall. So you want to be prepared. So ask yourself, where do you want to deliver? Do you want to deliver at home? Is a home birth for you? If so, you want to make sure that you research that, look at the pros and cons, and hire a midwife and a doula and get the supplies necessary to do that. Or if you want to deliver in a hospital, make sure you know what hospital you want to deliver at, what are their policies, because a lot of hospitals right now are canceling those birthing tours where you could ask those questions. And you want to see if you are going to have to give birth during this pandemic, how many people are allowed to be in the room with you. This varies. Some hospitals won't let anyone in the room with you. Some hospitals say only one person can be in the room with you, and this could either be your partner or a doula. Some hospitals say that the doula is part of the staff, so you can have one extra person in the room. So check that out, because if you have other kids and you planned on having them at the birth, you'll need a plan of what you need to do with those children. And let's say a family member gets sick that's supposed to watch your child, what's the backup plan? Plus, you want to prepare for the worst case scenario in case you have to deliver at the hospital without anyone with you. You want to mentally be prepared for that. Another thing you want to consider is buying baby supplies and postpartum supplies early on, because I have noticed that retailers are really in a crunch. It's taking them time to get things to you, and things like baby wipes, basic pain relievers, antiseptic stuff, things like that are really hard to find. You have to look at multiple retailers to find it, if you can find it at all. Because what happened is that a lot of people bought it up and you can't get it. So look into that. Also, look at your feeding plan for your baby. Are you going to be breastfeeding, or are you going to be formula feeding, or are you going to be doing a combination of both? You want to get the supplies for that. Like with breastfeeding, if you want to use a pump, you need to get that. All the supplies that goes with the pump. Also, if you're going to do formula, you want to make sure you're buying the formula, you're getting the bottles, etc. Next, you want to look at maternity leave, and this is for women who are working. You may want to consider, if you're to deliver in the next few weeks, months, maybe taking your maternity leave early if you can, which will help decrease your potential exposure to COVID-19. Then you want to have a plan for after the birth of your baby, because your baby is going to be susceptible to this virus going around along with other viruses, and you want to protect yourself as well. So normally when you have a baby anyways, you can't really go out and do much of anything for those first couple months, because they're so fragile, you're exhausted and tired. So in a sense, you already self-isolate. But with the coronavirus going around and everything, you may be self-isolating for a lot longer period. So make sure that you have a plan for how you're going to deal with all that during that time. And last but not least, you want to try to keep your stress level as low as possible and concentrate on the positive things rather than the negative things. And I know that is easier said than done. And being pregnant during this, I can tell you I've had my negative moments and my what if moments, like what if this happens, what if that happens. But I have figured out that it doesn't matter. I can stress all day long, but it's not going to change the fact that the coronavirus is here. It doesn't make it go away, and it doesn't change the fact that I potentially may be having a baby during this pandemic. So what I need to be doing, instead of putting my energy into that, I need to be putting my energy in being prepared and planning and being as informed about this virus as I can, staying in contact with my OB provider, because that's all you can really do. And just remember that this is literally just a season in our life. And this pandemic, I feel, is going to be over very soon. And if anything, it's making us stronger, and it's making us realize things that we have to watch out for in the future. So just know that you're going to have your baby with you here soon, and you can reflect back on this moment and say, wow, you know, whenever I was pregnant with you, there was a global pandemic going on, but you know what? We got through it. So that's all we can do, is stay positive and be proactive. Okay, so that wraps up this video on some tips that you can implement during your pregnancy while going through this pandemic. Now, I would love to hear from some other pregnant women, some things that you're doing to prepare during this pandemic. Share some things that you're worried about, or maybe some positive stories that you have heard or maybe experienced yourself during this pandemic, so we can encourage each other. And thank you so much for watching.